I'm Dr. Shilpa, your friendly dentist from Sweet Smiles Dental Clinic and Implant Center, Pune. And as promised, I'm back again with a descriptive video about dental implants. So, your teeth were designed to last you for a lifetime, but sometimes they don't. Replacing missing teeth is important not just for your oral health or general health, but for the health of the other teeth also. Not only do you lose your chewing ability when your tooth is lost, but the teeth which are not replaced can cause the other teeth to be lost by tipping or moving towards each other because of the space that's created. Also, there are obvious problems of poor appearance and loss of self esteem that is caused by one or more missing teeth. Dental implants should always be considered as an option to replace a failing or a missing tooth. So, what exactly is a dental implant? Dental implants are artificial tooth roots used to support a restoration for a missing tooth or teeth, helping to stop or prevent jawbone loss. So, people who have lost teeth might feel too conscious to smile or talk. Additionally, biting irregularities caused by tooth loss can actually have negative effects on eating habits, leading to secondary health issues like malnutrition. So, by replacing missing tooth roots, dental implants provide people with the strength and ability required to eat all kinds of food that they love without struggling to chew. They also help to stimulate the bone and maintain the jawbone, preventing bone loss and helping to support the facial features. So, to determine if the implants are right for you or not, a dentist consultation is required. During this appointment, your dentist will thoroughly examine your teeth, your gums, and evaluate the bone density and quantity. This may involve a couple of x-rays, and you also may require to go for a CT scan, a tomography scan, computer tomography scan, to ensure that there is sufficient bone structure for the placement of the implants, and also to determine exactly where the implants should be placed. Based on the condition of your oral tissues, oral hygiene, personal habits, and commitment to follow the aftercare instructions, your dentist will then advise you the most appropriate treatment plan. Some patients with insufficient bone or gum tissue require bone or soft tissue grafts or may use small diameter implants called as mini implants. So, depending on your situation, your dental professional will advise you how long the entire treatment process will take, or how many appointments will be necessary, or what can you expect after each procedure. During the consultation, the options of a local anesthesia to numb the area and sedation dentistry, if necessary, will also be discussed. The estimated cost of your dental implant and the type of dental implant which you might have to go for or which are available will also be discussed with you during the consultation process. And the cost of a dental implant varies on the type of implant which is placed and the treatment option which is suitable for you. So, are you a candidate for dental implants? An ideal candidate for dental implant is supposed to be in generally good health. Adequate bone in your jaw is needed to support the implant, and best candidates have healthy gum tissue and are free of periodontal diseases or gum diseases. Any underlying oral health issues must be first managed before implant placement is considered. Common issues like tooth decay or gum disease can make the treatment or dental implant treatment less effective. Also, if you are a smoker, your dentist will advise you to quit smoking, as smokers face a greater risk of failure than non-smokers. Smoking actually affects the osseointegration, the process by which the dental implant anchors to the jawbone. And once your dentist seems comfortable with your condition, with your oral and general health condition, and considers your mouth healthy enough for treatment, your custom treatment can begin. Placing the implants. The first question anyone asks us is, Doctor, is it going to be like really painful? Trust me, it is not very painful because of the local anesthesia which is given. It is almost, in most of the patients, absolutely painless. Today's dental implant restorations are virtually indistinguishable from other teeth. The procedure typically performed in a single sitting but requires period of osseointegration. Osseointegration, the process by which the implant anchors to the jawbone. An osteointegrated implant takes anywhere from 6 weeks to 6 months to anchor and heal, at which point your dentist can complete the procedure of your restoration. Dental implantation, which is performed to replace missing teeth, can be done anytime after adolescence or when your bone growth has completely finished. So, generally, about anyone over the age of 16 to 18 is what we generally consider to be fit for implant. Certain medical conditions such as active diabetes, cancer, or periodontal diseases may require additional treatment before the procedure can be performed. So, do you require any preparation of the jaw for implantation? Yes. A dental implant and its restoration is commonly composed of a titanium material screw and a crown. A small diameter hole is drilled into the area where the implant has to be placed, and it acts as a guide to actually put the implant. To avoid damaging vital jaw and facial structures, the dentist must use absolutely great skill and expertise when boring the pilot hole or sizing the jawbone. In most of the instances, X-rays are taken to guide the implant pilot drill placement. Then comes the placement. After the initial pilot hole has been drilled into the appropriate jaw size, it is slowly widened to allow the placement of the implant screw. And once in place, surrounding gums are secured over the implant, and a protective screw is placed on the top to allow the site to heal and osteointegration to occur. After up to 6 months of healing, 4 to 6 months generally, your dentist will uncover the implant and attach the abutment, which holds the crown or the tooth-like replacement. In some cases, the abutment may be given in the initial procedure only. So sometimes the final crown can be fabricated on the same day, but temporary crown serves as a template around which the gum grows. So generally, in most of the cases, the two-stage implant procedure is done. What can we expect in a recovery or a follow-up? Dental implant recovery depends on a number of factors, one of which includes various procedures required to complete your treatment. However, it's generally recognized that once an implant has been placed, maintaining diligent oral hygiene habits ensure proper integration with the bone structure. Failing to floss and brush can contribute to the failure of the treatment. Infection can occur if the implant and the surrounding areas are not cleaned properly. Smoking also is attributed to high failure rates and should be avoided following implant procedures. If provisional restorations were placed along with the implant, it will be extremely important to clean them as you would have your natural tooth to ensure the best possible healing and fusing. After the initial surgical process, discomfort should be minimal. Swelling of your gums and face may occur, as well as minor bleeding and bruising may happen. Prescription medication for pain and infection may be prescribed by your dentist to relieve you of any discomfort you feel after the procedure. You need to take those medications for 5 to 7 days, and your diet should be restricted to soft diet. If stitches are present, you need to get your stitches removed by the dentist after 7 to 10 days. Healing of the surgical procedure to place the implant takes about 3 to 6 months, while fitting and seating of the crown can take another 20 days. Again, this time frame depends on individual case and treatment done. Following appointments with your dentist are essential for monitoring your progress. If cared properly, it can remain in place for a lifetime. So why should I choose an implant over a bridge or any other prosthesis? Every way you look at it, dental implants are the best solutions to the problems of missing teeth. Why? Because a dental implant is the most natural, cost-effective, and least invasive way to replace a missing tooth. The first reason why you should go for an implant is aesthetics. Teeth implants look and feel just like your own teeth. Since dental implants integrate into the structure of your bone, they prevent the bone loss and gum recession that often accompany bridgework and dentures. No one will ever know that you have a replacement of a tooth. Second, it's conservative. Dental implants don't sacrifice the quality of your adjacent teeth like a bridge does, because the neighboring teeth are not altered to support the implant. More of your own teeth are left untouched, and a significant long-term benefit to your oral health is given because of the implants. The third is the confidence. A dental implant will allow you once again to speak and eat as comfortably and as confidently as you would with your natural teeth. They are secure and offer freedom from those clicks and wobbles of the denture. They'll allow you to say goodbyes to worries about misplaced denture and messy, paste and glues to stick the dentures. And the last but not the least is reliability. The success rate of dental implants is highly predictable. They're considered the best option for tooth replacement. A bridge or a partial denture will have to be replaced many times in your life because it completely depends on the structure of the bone, underlying bone. And the bone actually changes over a period of time. So every time you change a denture or a bridge, it costs you much more in the long term. Whereas your implants are supposed to be lasting you for a lifetime once done and maintained properly. So implants are anytime the best options. More than 60 companies manufacture dental implants, and the material used to create the restorations placed on top of them. As a result, the dentists have many options for identifying the right treatment for specific patient needs. However, be aware that for specific patient needs, a specific implant has to be placed. If you undergo an implant procedure by one dentist and see a different dentist for a repair, your new dentist may have very limited experience with or may not have access to the material components used by your previous dentist. So generally, as much as possible, make sure that you get your entire treatment procedure done with the same dentist, or if at all in future you need a repair, go to the same dentist. The dentist has your older previous records and exactly knows the material used for you. So this is all that was there for about implants. I hope it was helpful. And in case you have any doubts or queries, please put in a comment and I will be very happy to answer all your questions. We are available on all social media platforms and we are accessible on phone and on email. My phone number and the email ID will be given in the post that is there with this video. And please feel free to contact us. I'm Dr. Shilpa Rao saying a goodbye to you for now from Sweet Smiles Dental Clinic and Implant Center. Thank you and take care. Stay safe. Bye-bye.